Hi, my name is Lord Cabahug, student number 3031370 in the PN program right now, and I will be showing you how to administer sublingual and buccal medication to a patient. So the first thing you need to do is to perform hand hygiene, and then to provide the patient with some privacy, and then to introduce yourself. Hi, my name is Lord Cabahug. I'm going to be a practical nursing student today, and the next thing to do is to identify the patient with two identifiers by looking at the wristband. So their first name, last name, and their date of birth to make sure you have the right patient. Next, I'm going to inform Miss Catherine, just for the sake of this demonstration, that I will be administering buccal or sublingual medication, and I'm going to teach her how to properly take in the medication. I will teach her the proper patient teachings that is required for the medication. But first, I'm going to ask for her consent to do a quick vital signs to get her vital signs to see how she's doing, to get her SpO2, her BP, her temperature, her pulse rate, her respirations, and and to do a pain assessment if necessary. But before that, I'm going to adjust the height of the bed to a comfortable working height. I'm going to put the side rails down. Then I will proceed with the vital signs. After obtaining her vital signs, I will now put the side rails back up and put the bed down, wash my hands, and I'll inform Miss Katharina that I'll inform her that I will be at the med cart preparing her medication. So pretending that I'm at the med cart, I will be doing the three checks with the five rights. I will be doing the five rights. I will be doing three checks of the five rights three times. If it's the right patient, the right medication, the right dose, the right route, and the right time. Also rechecking the expiry date just to be sure. So as I'm pulling the medication out, the medication is still intact in the container. I am cross-referencing it with MAR just to see if it's the right medication, also if it's the right dose, the right route, and the right time. Reviewing it, reviewing it with the doctor's orders earlier. As I'm preparing the medication, putting the medication in a plastic container for the patient to check, for the patient to uh, individually take on her own. I'm rechecking it again if it's the right patient, the right medication, the right dose, the right route, the right time, also the expiry date. As I'm cleaning everything up on the med cart, I'm doing one last set of checks to see to minimize medication errors, to prevent medication errors rather. I'm sorry. So I'm rechecking it. As I'm holding the medication, I'm holding it close to the MAR. If it's the right name, the right name of the patient, the right medication, the right dose, the right route, and the right time. So I'm putting everything back in, locking the med cart, going towards the patient, and I'm performing another set of hand hygiene. Now I'm going to lift the bed at a comfortable working height, putting the side rails down, introducing myself again. Hi, my name is Lord Kabahog, and I have your medication ready and to go. But before giving the medication, I am going to do my other five rights, such as the right reason. If the doctor has prescribed the medication uh, for the right reason, I'm going to ask the patient that too. If she has taken this medication before and if she's comfortable taking it. If she's not, she does have the right to refuse, and I will just have to document that later on my documentation, like my client care record, or I will have to contact the physician if there's anything else that we can give her. Also, the right education for sublingual medication. The most efficient way to take it is to be under the tongue because your saliva just breaks down the medication. For buccal, it is at the behind your molars or at the side of the cheeks. because for the same reason that the medication just works faster that way. And I will be back later in an onset of usually the medications take 30 have a 30-minute onset depending on the medication. I will be back later to do my final documentations and evaluations for Miss Catherine. Before giving the medication, I will be, however, giving her some water to drink first, just to assess her swallowing ability, because she is in a supine position and the medication might just go down her throat. And I'm just checking just to avoid the hazard of choking, rather. Sorry. And after that, after she takes her medication, I'm going to see if it's under her tongue or beside her cheek. After that, I'm going to lower the bed at the lowest possible position, set the side rails up, and I'm going to perform the last set of hand hygiene. Then I'm going to ask Miss Catherine if she needs anything else, like a glass of water, some orange juice maybe, if it applies. If not, I will leave the call bell in place at her side in a visible, reachable position, and I will be right back in 30 minutes to do my final set of checks and evaluation, also my documentation. So that is how you administer sublingual and buccal medication to a patient.